be your nurse today, okay? Can I check your name, Dan, please? And can you spell your first and last name for me?
CHRIS
Mm-hmm.
PETERSON,
And your date of birth?
March 1st, 1984.
Okay, I'm just going to make sure it matches your medical record. Thank you. So you can go ahead and take a seat right here. I'm also going to close the door or pull the curtain for privacy. And for the purpose of this video, I'm just going to state that Mr. Peterson's height was 5'9", his weight was 155, his temp was 97.9, and his blood pressure was 120/80. Mr. Peterson's gait was steady, he is dressed appropriately for the weather, he is well groomed and has no foul odor. So Mr. Peterson, I'm going to be working with you today doing a physical assessment, and you're here for your yearly physical, right?
Yes.
Okay, so I'm just going to start off by going through a few questions with you. Do you have any pain at this time?
No.
Okay, and do you sleep 8 hours every night?
Yeah.
Good. Do you have any complaint pains, any certain areas that are bothering you?
No.
Okay, great. And how about your diet? Do you think you have a good diet?
Yes.
And what does your
Well
diet
balanced.
usually consist of?
Fruits, vegetables, lots of meats, fish.
Good. And any nausea or vomiting?
No.
Good, okay. And could you just read the top of this for me?
Toyland wish list book.
Perfect, thank you. So, Mr. Peterson is alert and oriented ×3. He shows that he understands written and spoken words effectively. Okay, Mr. Peterson, now I'm going to go through a few more parts of our exam, and I'll explain to you as we go what I'm doing, okay? So I'm going to have you just sit right up, like that. Thank you. So right now what I'm doing is I'm just looking at the scalp, making sure that everything is intact, there are no moles or bumps or any swelling going on. I'm also going to put your head right up here. I'm going to feel for your temporal pulse. And then I'm also going to come down here and feel your glands. And then I'm also going to feel for your carotid pulse as well. Okay. And then, so basically what I'm seeing here is skin is warm and dry and intact, no swelling, no masses or lesions. Next, Mr. Peterson, I'm going to be looking in your eyes, checking your eyes, okay? So you can look straight at me, and just focus on my nose, okay? So pupils are equal and round and reactive to light. And I'm going to have you follow my finger, okay? And also accommodation. So next what I'm going to do is feel for your brachial pulse. And I'm also noticing here that there are no problems with the skin on his arms. Skin is warm, skin is dry, skin is intact. I'm also going to do a skin trigger test, which is I'm just going to be pinching your skin, okay? And it goes right back down, so that's good, healthy skin. And next I'm going to be feeling for your radial pulse, and I'm going to be counting that for 1 full minute, okay? So I'm going to take your hand right here, just relax your arm. Okay. Okay, so Mr. Peterson's pulse was 82, which is within healthy range. And I also want to point out During the visual exam, I also see there are no masses or lesions near or around the eyes, and also no discharge around the eyes or ears. Peterson, now I'm going to be working with you on your mobility and your range of motion, okay? And I'll still explain to you everything I'm doing. First, I'm going to have you hold out your arms and push down on my hands. Good. And you can stop. And now the other way and push up. Good. And I'm going to have you just relax your arm and lift. Okay, you can put that one down. Same on this side. Relax your arm and lift. Okay, you can put that one back down. And can you show me just a big stretch out and in? Any pain with any of your joint movements?
No.
Okay, good. So now I'm going to have you do the same thing with your wrists, inside and out, and your fingers. Any pain?
No.
Good, and you can feel your fingers. Can you feel when I'm touching your fingers?
Yeah.
Okay. And then I'm also going to have you do the same thing with each leg. And then I'm also going to have you get up and do some walking, and I'll tell you about that as we go. Okay. So go ahead and lift your leg for me. And just put your foot right on top of my hand and push down. Good. And now same thing, push up. Very good. And same with this foot, push down. And push up. Okay, good. So you can see with Mr. Peterson's range of motion, he has a good range of motion, no pain in his joints. He has full range of motion in all of his areas, in upper extremities and lower extremities, and has strength bilaterally. Next, I'm going to have you curve your feet inwards. Just kind of turn them up like this. And then out. And same with the other foot. Just the foot, not the whole leg. Okay, thank you. And I'm also going to have you stand up. And I would like you to walk towards that lamp on your heels.
Okay.
Go ahead. And then you can stop and turn around, and you're going to walk right back over toward me on your toes. Okay, so you can stand right here. So Mr. Peterson shows no physical limitation, and there's also no sign of muscle atrophy. There's no sign of muscle weakness or contraction, and he shows coordination and balance. And now, Mr. Peterson, I'm going to be looking at your spine, okay? If you could just turn around for me and go ahead and touch your toes. Now, I'm looking to make sure that there is normal spine curvature, which there is, and each side is symmetrical. So that's all set. You can go ahead and stand up, and you can go ahead and take a seat. Okay, Mr. Peterson, now I'm going to take a look at the rest of your legs. I'm going to have you just pull your pant legs up to your knees for me, please. So at this time, I'm assessing the skin for any petechiae or bruising, any edema. I'm also going to take his peripheral pulses. And this is his popliteal pulse, which is right behind his knee. And then I'm also going to take the posterior tibialis. And then also, you can put your foot down, the dorsalis pedis, which is right in between the great and first toe. Okay, and skin is warm and dry and intact. You can go ahead and pull your pant legs down for me. Thank you. And Mr. Peterson, how do you feel your activity level is?
Pretty good. I
Good.
usually exercise in about an hour a day.
Okay, good. Next, what I'm going to be doing is listening to your heart. So I'm going to have you go ahead and sit up straight, and I just get myself ready here. Okay, so I'll tell you what I'm doing as I'm doing it. I'm just going to have you pull your shirt up for me. So the first spot that I'm going to be listening to is the second intercostal space, which is the aortic valve. So we're going to feel from the clavicle, 1, 2, and that is the second intercostal space, and that is the right sternal border. And next I'm going to move over to the pulmonary valve, which is the second intercostal space on the left sternal border. Next I'm going to be listening to Erb's Point, which is the third intercostal space, left sternal border, and this is where you can hear the pulmonary and aortic sounds. Fourth intercostal space, left sternal border, is the tricuspid valve. And fifth intercostal space, midclavicular line, is the mitral valve. Okay, so there are 2 heart sounds. S1, which is a lub sound, is the beginning of systole, and that's heard best at the apex of the heart, which is the little pointy part at the bottom, which is right about down here. And then the second sound, which is S2, is the dub sound, which is the end of diastole, and it's heard best at the base, which is right up here. And I'm also going to take an apical pulse, which means I'm going to be listening to your heart right here for 1 full minute, okay? Mr. Peterson, can you swallow for me, please? Perfect. And I'm going to check your hands. What I'm going to do right now is check what's called a capillary refill. So I'm just going to squeeze the tip of your nail right here and just watch your color come right back. So capillary refill is less than 3 seconds, so that's good. The next thing I'm going to be doing is listening to your lungs. So I'm going to start off, if you could kind of just scooch up a little bit and turn right towards me. So I'm going to start off in the anterior portion of your body, and then I'm going to do the posterior portion of your body. Okay, and I'll explain to you as I go.